Hi everyone and welcome back to our little review channel. This video is part of a series I'm doing on pediatric cardiovascular disorders. Don't forget to check out the description box below because I've also prepared for you guys a set of interactive notes to help you scribble along with the discussion, summarized notes to help you understand it in a tabulated form, a set of flashcards to help you memorize, a quiz to help you test yourself, and a summary to help you understand all of the topics together side by side. You may also explore our shop where we do more of these all-in-one packages that are basically crash courses for several nursing topics to help you with your board exam preparation. So don't forget to join our community where you guys can connect with us and with other nursing students. Without further ado, let's get along to the video. Let's move on to our cardiovascular disorders, particularly our patent ductus arteriosus. All right, hopefully you guys have watched our normals video because I explained there the ductus arteriosus. But in case that you haven't, I will explain it for you right now. So this over here in orange, that is our ductus arteriosus. The ductus arteriosus is a blood vessel. A blood vessel that connects. What does it connect? Our aorta and our pulmonary artery together. Aorta and pulmonary artery in fetal circulation. Now, I would like to emphasize that the ductus arteriosus is normal when it is found in the fetus, inside the womb of the mother. Okay, it is one of the three shunts in fetal circulation. Now, why again do these shunts exist? Because the lungs in the fetus do not exist yet. I mean, they exist, but they're non-functional yet. So our body finds a way to bypass the non-functional lungs, which is why these shunts exist. Again, this shunt, the ductus arteriosus, is normal when it is present in the fetus. However, when the mother gives birth to the baby and you have the baby already and the baby breathes air for the first time, the lungs suddenly become functional. Okay? And this ductus arteriosus at birth is supposed to close. Okay? Normally at birth, the ductus arteriosus is supposed to close. However, okay, in patent ductus arteriosus, it fails to close, it remains open, and therefore it is patent. Okay, patent means it is open and it fails to close. Did we understand that? Okay, supposedly. So again, what is patent ductus arteriosus then? Ductus arteriosus that remains open. So this is a congenital heart defect where in the ductus arteriosus fails to close. And so what? What happens if it does not close? Is that such an awful thing? The answer, yes. How come? All right, so let's take a look at this comparison over here between a ductus arteriosus that closed at birth and the ductus arteriosus that failed to close at birth. So first, over here, let's take a look. Again, normally, once you breathe for the first time, the ductus arteriosus is supposed to close. Okay, so deoxygenated blood enters our inferior vena cava and superior vena cava, which enters our right atrium, then our right ventricle, and then enters through our pulmonary artery. And then now, because our lungs are functional, okay, it can receive blood and it can reoxygenate that blood. and send it back to the heart through the pulmonary veins, into the left atrium, the left ventricle, and then the aorta, and the rest of your body. And the cycle continues. Again, that is normally how it is supposed to look like once your ductus arteriosus closes. However, what happens in the ductus arteriosus that fails to close? Now, our lungs are functional here already, but there is a ductus arteriosus that shunts blood away from the lungs. Okay? Supposedly. Now, let's take a look at this. So your deoxygenated blood enters your superior vena cava and inferior vena cava, and then your right atrium, then your right ventricle, and then your right, and then through your pulmonary artery into your lungs. So up until that point, it is normal, right? Where the blood gets reoxygenated, enters your pulmonary veins, all right, and then your left atrium, and then your left ventricle, and then to your aorta. However, instead of going to the rest of the aorta, because of the presence of the ductus arteriosus over here, blood goes this way instead, through the ductus arteriosus and into your pulmonary arteries, where the blood again is brought back to the lungs, from the lungs to your pulmonary veins, okay, and then to your left atrium, and then left ventricle, supposedly to the aorta and to the rest of the body. But that does not happen because your blood is shunted back through the ductus arteriosus into your pulmonary artery. So this is the cycle that our blood goes through when there is a ductus arteriosus shunt. So if you can see over here, okay, goes this way as well, our lungs or our pulmonary circulation is getting so much blood because the ductus arteriosus keeps giving that shortcut back to the lungs instead of the blood going to the aorta and to the rest of the body. So if you can see and you can imagine, our lungs or our pulmonary circulation is getting too much blood, but our aorta and the rest of our body is getting very little blood. Do you understand and do you see the differences? So here it's very balanced because there's just that normal delivery of that circulation. However, here, because of that shortcut over here, blood keeps going back and forth into our lungs. Now again, I don't need you guys to memorize this. I will tell you later what are the things you have to memorize, but you will need this so that you will understand and what you are memorizing later on. Now here, therefore, if you can see, is there an increase or decrease in our pulmonary blood flow? Of course, there is an increase in our pulmonary blood flow. You understand that? Okay. Now this is the part that you kind of have to memorize already. First, you have your, we'll take a look at the signs and symptoms already. So over here, this one over here is your ductus arteriosus, right? And so when blood travels from the aorta, a lot of blood travels from the aorta through that small ductus arteriosus and into your pulmonary artery. Do you think you will hear a sound over here when you're auscultating the heart? Yes. And that sound is what you call this over here, this over here, that is your machinery-like murmur. So when you hear the heart in that area, in the left sternal area, because of the presence of that ductus arteriosus and blood gushing through that area, you'll hear some a machinery-like murmur, and that is our pathognomonic sign. Okay, pathognomonic sign for our patent ductus arteriosus. So I would like for you guys to put a star on that. Now another, again, what did we say? That there is an increase in pulmonary blood flow, right? So when there is an increase in pulmonary blood flow, over here, the blood keeps going to our lungs. Okay, the blood keeps going to our lungs. The lungs get stressed, guys. The lungs get so stressed. And when the lungs get stressed, what happens? Okay, the arteries become narrow. There's increased blood pressure to your lungs. And eventually, when there's too much pressure that happens here, there is what you call narrowing, okay, of the arteries in the lungs, which leads to pulmonary hypertension. So there's too much blood pressure, okay? Too much blood is brought to the lungs get stressed, the arteries narrow eventually, and that leads to pulmonary hypertension. Now, eventually, because there's already narrowed arteries in our lungs, meaning there's increased resistance, okay? There's an increase in the resistance over here, meaning that the arteries are narrow, but you're pushing a lot of blood. Okay, so that the pump here, the heart, has to exert much more effort to push that blood through the narrow arteries. And then your heart has to keep pumping more and more, okay? Because the resistance here is higher, so your heart has to pump more and more, which eventually leads to your heart getting tired through time. Hindi na niya kaya. And that leads to our signs and symptoms of heart failure. Your heart gets tired over time because of the increase in pulmonary blood flow. Did we understand up until that point? All right. Now here, take a look at this. So you have one side, right? One perspective of this is that there is too much blood that is brought to our lungs, too much blood flow in our pulmonary circulation. But over here, okay, the blood, not a lot of blood gets past that ductus arteriosus. Here, the blood is supposed to go this way, right? The blood is supposed to go this way, and then here. But that does not happen in ductus arteriosus. Only very little blood is distributed to the rest of the body. And when there is no blood distributed, or little blood, what does blood carry? Oxygen. And when there is no oxygen, there is no energy, which leads to fatigue, or otherwise known as activity intolerance. And what is the only activity of pediatric patients? They sleep and they eat, they feed, right? They breastfeed, right? So if they're not able to do that activity, feeding, okay, poor feeding, that leads to poor weight gain. Do you understand up until that point? All right. Take note also that this type of cardiovascular disease or congenital heart defect is acyanotic. Okay? Somehow, it is not the deoxygenated blood that is being transported. It is the very little lang na oxygenated blood. So you will not get that blue tinge because the problem here is not in the deoxygenated blood. It is just the lack of the delivery of your oxygenated blood. Okay? Another, irritability. How come? Because very little blood lang is brought to our head, neck, and trunk on your upper part of the aorta. Okay, because again, blood is shunted back always to the lungs and very little is brought to our brain. That leads to cerebral hypoxia. A pediatric patient can't tell you, my head is painful. Instead, irritability siya. Okay? Meaning that there is a high-pitched cry. You understand that so far? So these are the different signs and symptoms. Take a screenshot, write this down. I would like for you guys to memorize this. Next, let's take a look. Okay, especially machinery like murmur, patent ductus arteriosus. Because of that gushing of blood through that small ductus arteriosus, there is that machinery like murmur that you will hear when you listen through a stethoscope. Let's look at the treatment. Our medication, put a star again beside this, indomethacin. That is a prostaglandin inhibitor. Its goal is to close that ductus arteriosus. And also we can do surgical repair, meaning that surgically they will go down there and they will erase and remove that ductus arteriosus. Okay. And make sure the circulation goes back to normal. Now, if you don't take anything from it, okay, I want you guys to have understood that, but this is what I want you to memorize. This is your baon for the board examination. Okay, when we talk about patent ductus arteriosus, this is all I want you to remember. Machinery like murmur, acyanotic, signs and symptoms of heart failure, increased pulmocongestion, and indomethacin. This is all I need you guys to remember for patent ductus arteriosus. That's all. That is a summary of everything we talked about. Memorize that. That's all you have to bring with you in your pocket. This is your ammunition whenever you see patent ductus arteriosus. Before we move on to the next part of the video, I'm very excited to share that this video is very kindly sponsored by Maono. Maono, meaning vision, is the global best-selling internet microphone brand whose products are sold well in 153 countries worldwide. Maono very kindly sent me over the Maono Wave T1 Mini, which has super clear and natural audio, a 4-step AI noise reduction system, a companion app offering advanced audio functions and smart control such as smart voice changing effects, mic gain adjustment, among others, easy operation and 30-hour battery life, fast charging which enables 1 hour of use with just 5 minutes of charging. Links are in the description box below. You understand? Let's take a look and apply that to this particular question. So the primary goal of a surgical repair of a patent ductus arteriosus, okay, so the goal is to prevent which complication? Let's first list, without looking at the choices, everything that we know about patent ductus arteriosus, because the choices are there to confuse us, right? So the one I just listed, what is patent ductus arteriosus? Machinery like murmur, machinery like murmur, acyanotic, signs and symptoms of heart failure, increased pulmonary congestion or blood flow, and last is your indomethacin. So let's take a look. What complication if we do not treat the patent ductus arteriosus? Pulmonary infection. Let's take a look. Is it here? No. So the answer there, it's negative. So we're looking for the positive over here. Increased pulmonary vascular congestion. Is it here? Here, increased pulmonary congestion. So I would say yes. That is an option. Decreased workload on the left side of the heart. Is that over here? Decreased workload on the left side of the heart. What is the left side of the heart? The left side pumps blood to your aorta. But there's a lot of there is a lot of blood flow. Again, right? A lot of blood flow to the heart, to the lungs. And eventually, is it a decrease or an increase in workload of the heart? Diba? Eventually, your lungs have increased resistance. There's so much resistance in your lungs that your heart has to keep pumping. So is that a decrease or an increase in workload? Of course, it is an increase in workload. Okay, so that is wrong. Is it a right to left shunting of blood? Okay, so it's actually a left to right shunting of blood. And also, so over here, increased pulmonary congestion, increased pulmonary congestion. This is our answer. All right. So I hope you learned about patent ductus arteriosus. If you have any more questions, please feel free to contact me. I have made notes, flashcards, and quizzes on this particular topic, and I hope you learned something from this. You're free to move on to the next.